Well, a team of Ebola experts left the U.S. Wednesday to visit Congo's rural northwest to help prevent its spread. VOA's Carol Pearson reports on what's different about the outbreak in Congo and the epidemic that swept through West Africa 4 years ago.
The first batch of experimental Ebola vaccines arrived in the Democratic Republic of Congo on May 16th. But there are few similarities between the current Ebola outbreak in Congo and the outbreak that ravaged West Africa for 2 years, from 2014 to 2016. One major difference is that there is now an experimental vaccine. While the vaccine was developed during the West African outbreak, it has proven to be safe and effective.
Merck, the vaccine manufacturer, has reassured WHO that we have access to further doses of vaccine as necessary during the outbreak.
The health ministry plans to start vaccinating those exposed to the virus in the next few days. Isolation units to treat the sick are already in place. And even though the outbreak is in a remote rural area, no one involved is taking anything for granted.
We are very concerned and we are planning for all scenarios, including the worst case scenario.
The head of the World Health Organization has visited the country, and the government of Congo has agreed to cooperate.
I thought it was very commendable and a great sign of the change of outlook that Dr. Tedros himself was personally there, and that was very important. It rallies the troops, it shows determination and commitment and speed.
The WHO has reorganized since the devastating outbreak in West Africa that killed more than 11,000 people. A lot of lessons were learned from that epidemic.
The response to this outbreak has been quite different from the very delayed response over a 6-month period in 2014 in the outbreak in West Africa. It's the 9th outbreak in Congo. This is a country that has a lot of experience in dealing with outbreaks of Ebola.
While the fear is that the outbreak could travel to major cities, as it did in West Africa, systems are already in place to make sure that, if at all possible, it doesn't. Carol Pearson, VOA News, Washington.